Pregnancy is a journey one needs to be ready and prepared for physically, emotionally, mentally, and financially. This doesn't only apply to the woman, but the men are also involved. That is why preconception care is very important. In this video, I'm going to talk about 12 things you need to know and do before you get pregnant. Hi, I'm Naki the midwife and welcome to my channel. On this channel, we talk about issues on pregnancy, delivery, babies, and family planning. Here are 12 things you need to do and know before conception. What is preconception care? Preconception care is basically the healthcare services or support that both men and women receive before they try conception or before they try to have a baby. So the first thing you need to know is your BMI. BMI is your body mass index. This determines whether you are overweight or underweight. If you are overweight, you are at a risk of developing pregnancy-induced diseases such as diabetes or hypertension. And if you are underweight, you are at a risk of having low birth weight babies. Someone may ask, how do I know my BMI? If you walk into any healthcare facility, you will be helped with that. They can help you calculate your BMI. Secondly, healthy diet. Before conception, it is very important to eat a healthy diet or a well-balanced diet, which includes whole grains, vegetables, and lots of fruits, and also take lots of water. This helps to have a healthy pregnancy. Third, take folic acid, vitamins, and iron supplements. Taking 400 micrograms of folic acid daily helps reduce what we call neural tube defects. Now, the neural tube is a structure which eventually develops to form the brain of your child and also the spinal cord. So if there's a defect in it, then the brain or some part of it refuses to develop. And also the spinal cord of your child does not develop properly if there's a defect in this tube. When it comes to taking vitamins, it helps to develop the nervous system of your baby. And also for iron supplement, it helps boost your hemoglobin level. Therefore, it prevents you from getting anemia. Exercise. Research shows that women who exercise regularly before pregnancy and during pregnancy tend to have a healthy pregnancy, and also it reduces the risk of getting complications during delivery. Screening for sexually transmitted diseases. It is very important for you to get screened to know whether you have any sexually transmitted diseases such as HIV/AIDS. HIV is one of the viruses that can be transmitted from the mother to the baby in utero. So it is very important for you to get screened so that if you know you have any of the sexually transmitted diseases, you will be managed even before you think of getting pregnant. Vaccination against preventable diseases. Diseases like rubella, tetanus, and hepatitis B are some of the diseases that crosses the placenta barrier and gets to your child and goes to harm your child. So these are some of the diseases that you can get vaccinated against. We have the vaccines. Just walk into any health facility and get vaccinated against these preventable diseases. Mental health. The mental health of both partners is very crucial for a healthy pregnancy, especially with the woman. Poor mental health results in physical problems such as the woman having a difficulty to cope with the child after delivery, or having a difficulty bonding with the child after delivery. This affects the development of the child in the long run. Don't take your mental health for granted. Get screened. Pre-existing medical conditions. If you have been diagnosed of any medical condition such as hypertension, epilepsy, or diabetes, it is very important for you to be managed before conception, because these diseases get aggravated by pregnancy and causes a lot of complications during delivery. So get treatment or get managed if you know you have any of these pre-existing medical conditions. Drugs. If you are on any contraceptive pill, you need to stop it within a period of 3 to 6 months before conception, so that there can be a normal hormonal regulation and ovulation before conception. Also, drug abuse. Drugs such as marijuana or cocaine have been known to cause a lot of malformations such as miscarriage or abortion. So if you take any of these drugs before conception, you need to stop. Smoking and drinking alcohol is very bad for your health and that of your child. Cigarette contains a whole lot of chemicals, and one of these is known as nicotine. Nicotine crosses the placenta barrier and goes to constrict the blood vessels that send nutrients and oxygen to your child, hence resulting in abortion or miscarriage. And also, alcohol. It also crosses the placenta barrier and goes to cause what we call fetal alcohol syndrome. History and investigations. You need to know your family history, whether any diseases or illnesses run through the family. Diseases such as cancer, diabetes, or hypertension runs in families a lot. So, if you have a family history of any of these diseases, you are at a high risk of developing some. So you need to know so that you can be managed before pregnancy. And investigations. Get to know your blood pressure, whether you have a normal blood pressure or not. Get screened for cervical cancer if you're a woman. And if you're a man, make sure you get screened for semen analysis. This helps to know whether you have a low sperm count or not, or whether you are fit enough to impregnate a woman. Last but not least, genetic counseling. We have heard stories of people who just meet, fall in love, and go ahead to get married and start having kids without knowing their blood group or even their genotype. This has caused a whole lot of problems for a lot of people. Genetic counseling helps you to know your genotype, to know your blood group, and also to know whether you are fertile enough to have a child. If this video has helped you in any way, subscribe to my channel, Naki the Midwife, and revisit our channel again and again for interesting topics like this. Let's get interactive in the comment section. Like, share, and also subscribe. Thank you.